The Chair would now like to recognize the very valuable member of our committee who serves as the ranking member of the Health Subcommittee, the gentleman from Georgia, Mr. Deal.
Thank you, Mr. Chairman. Throughout history, most major societal changes have come about in one of two ways. They've either evolved over a period of time and are incremental in nature, or they've been the result of sudden, often cataclysmic actions that happen rapidly. In both cases, however, there must be an underlying reason for the change. Today, this committee begins the process of implementing one of the most monumental changes in American society to take place in our lifetime. It is the transfer of the responsibility for providing health care from the individual citizen and his employer in the framework of a free enterprise system to the federal government, where legislators and bureaucrats are expected to decide how health care will be delivered to our citizens. Unlike the incremental approaches of the past, this is a legislative tsunami that will sweep away the long-standing advances that have made our health care system the envy of the world and leave in its wake a system of government-dictated health care that at best has a lackluster record of success in those countries that have tried it. But every change, whether incremental or revolutionary in nature, must logically have a reason in order to justify the change. In this case, one of the stated reasons for change is the desire to provide health insurance coverage for those who are currently uninsured. According to the testimony from CBO on yesterday, even after the plan is fully implemented, there will still be 16 to 17 million non-elderly that will remain uninsured. One of the other reasons for this reform is that it will make health care more accessible. Access depends on having doctors and hospitals that are willing to accept patients and the payments for services that they will provide. We know that these providers are already being compensated by Medicare at rates that are often below their actual cost of providing care. Yet this bill will establish a reimbursement schedule that is based on Medicare rates. If those rates are already making it difficult to find providers who will accept Medicare payments, what do we expect will happen when those rates are imposed on the general population? Well, so much for improving access. Another reason for this has been given is that the cost of health care needs to be reduced. Once again, based on CBO testimony, this bill will increase the federal deficit over the next 10 years by $1.042 trillion. That does not include the adverse effects on the economy as a whole, which CBO can't calculate, but they acknowledge will perhaps result in 750,000 job losses. These are just a few of the reasons that I oppose this legislation. No new doctors and nurses, lower payments to all health care providers, a restriction on choices for all Americans, a loss of hundreds of thousands of jobs, dramatic increases in the federal deficit, and lower quality of care. These are indeed changes, but I don't think they're the changes that Americans want. Thank you, Mr. Chairman.
Thank you, Mr. Deal.